Hi. If your child is one of the 6 million between the ages of 3 and 4 and 17, 3 and 4 and 17, diagnosed with ADD or ADHD, or perhaps one of the 80% of those, which makes 4.5 to 5 million, among the 4.5 to 5 million who are on medications for ADHD, and you're searching for a different kind of solution, a different kind of option, I'm here to offer you hope and help. Stay tuned, watch the rest of the video, and we'll talk. Because if you're watching me and you found me, it's probably because either the medication stopped working and you don't know what else to do. You love your child and you don't know what else to do. Or because your child has suffered one of the many side effects of these medications, and you love your child and you want a different kind of option, a non-drug option. Well, hi, I'm Dr. Steve Rosman of Rosman Whole Person Healthcare and YourBrainHealthDoctor.com, and I'm here to offer you some options. I'm here to give you some hope, and I'm here to give you some help. And I want to do it tonight by talking about one child I treated. And maybe her story will sound enough like your child's story to give you some hope, to give you some help, to give you some direction. So now it's just us talking. But I want to share with you the story of Nicole. Nicole is 13 now, but she first came to me when she was 8 years old. But she was first diagnosed with ADD, ADHD when she was 5. And at that time, she was put on medications, and the medications seemed to work at the beginning, a combination of the stimulants and then the non-stimulants. And at the beginning, she focused better. She was young, so she was in kindergarten, first grade. She performed in school doing those tasks better. She showed less hostility. She got sidetracked less. She focused better. She felt better about herself. Had some friendships. And all proceeded well for a bit until the medication stopped working as well. And then she was put on a second medication. And then eventually a third medication. And then another medication to work with the side effects of the 2 medications she was on at that time. So by the time she got to me, she had been on 5 medications, and one of them wasn't even an ADD, ADHD medication. It was actually a medication to reduce the side effects of those medications, because those medications had either stopped working or Nicole suffered one of the many side effects of those medications. And those side effects, as you well know, could include heart symptoms like palpitations bouncing through your chest, psychiatric symptoms like depression or anxiety. They could be digestive symptoms. They could be lack of sleep, insomnia, sleep disruption. They could be loss of appetite. And in some cases with the non-stimulants, they could even be fatigue, drowsiness, and there are many other side effects which I'm sure you're aware of. Nicole suffered some of those. And so her mother found me. And it's an interesting story. I'm in Florida. They live in New Mexico. They found me through a psychologist in California who had a patient, a 7-year-old boy at the time, who had worked with me. And the psychologist worked with me because I'll co-manage, I'll partner with anyone as long as it helps your child. And the psychologist was a family friend of Nicole's parents. And when he heard about her struggles, he contacted them and said, "You ought to give this guy in Florida a call." Well, you can see they're not around the corner. And I do treat people who are local, but I can also work through video chat and phone with those who are not. And Nicole and I and her mom used to enjoy our phone chats, occasional video chats, In any event, we got our work done. I work with functional medicine and functional diagnostic nutrition, and it offered a different path to working with Nicole than giving her medication and working with symptoms, the symptoms those medications would address. Now, in functional medicine, we might look at an iceberg. Imagine an iceberg with me for a second. The tip of the iceberg above the water is the diagnosis. So Nicole was diagnosed with ADD, ADHD. That sits above the water. But the iceberg really comes from what contributes to the iceberg being seen. That's what grows beneath the surface, what looms beneath the surface. And in functional medicine, functional diagnostic nutrition, we feel the same way. What is it in the biochemistry, in the physiology, in the metabolic pathways that become dysfunctional? And the body then shows signs and symptoms that come to be diagnosed as either this or that, in Nicole's case, ADD, ADHD. We use conventional and functional lab tests, which expand the search, look deeper and more comprehensively, out of the box, shall we say, but with licensed, credentialed labs. And we were able to find out some things for Nicole and for her mom that were very important. We were able to find out she had a magnesium deficiency. We were able to find out she had a problem with something called methylation. Now, without going too much into biochemistry, I don't know how you enjoyed that or didn't enjoy that in school, but let me say, without going too much into biochemistry, methylation is simply the process of adding a molecule to other molecules, and by doing so, enable those molecules to do lots of important tasks. In Nicole's case, the task was to create brain chemicals that manage mood and manage behavior. With methylation difficulty, she couldn't do that. We were also able to find that the melatonin, the hormone responsible for deep stage sleep, her melatonin levels were low, but her stress hormones, even at night, were elevated. So she didn't sleep well. Her sleep was disrupted, shallow. She awoke the next morning not feeling refreshed. The sleep wasn't satisfying or healthy for her. We also discovered that she lacked certain kinds of bacteria in her gut. Now, you've watched TV, you've read magazines, you heard it somewhere at a soccer game, people talking about probiotics. You find them in drugstores, supermarkets, as well as health food stores on the net. Probiotics are very special, good bacteria that nourish the body, nourish the brain in so many different ways. We were able to actually test and find that in Nicole's case, she lacked certain strains, not just probiotics in general, but certain strains of bacteria. And we were able to replenish those. Now, in most cases, these were simple kits that the lab was able to send to Nicole's home, where her mother was able to administer it to her with urine, stool, saliva. Nothing complicated, in the privacy and comfort of her own home, and send the kits out to the lab. The results came to me. And the results showed me ways that I could actually nourish her body, nurture it, make it healthier, give it what it's missing. It was missing. And by doing so, the signs and symptoms of ADD, ADHD gradually disappeared. Now, not overnight. And I should also mention, we did find through some journaling and some testing that there were some foods that when eaten, an hour later, 2 hours later, 4 hours later, not immediately, produced some of the symptoms that were diagnosed as ADD, ADHD. So in Nicole's case, over about 7.5, 8 months, working with her psychiatrist, her pediatrician, and psychologist, because I'll co-manage if that's what you wish, or we don't need to. But in this case, Nicole's parents wanted me to, so we did. So all together, partnering, because I'm here to partner with you. I want your child to feel well, to be well, to perform well, to feel good about himself, to feel good about herself, because he or she is thriving and achieving. And in this case, we were able to give Nicole's body what she needed and remove from Nicole's body what it didn't need. And over the course of those 7.5 months, we slowly, gradually titrated and got her off of all medication. So by the time she was about 8 and a quarter, she was off of all medication. She's now 13 and has never gone back to medication. And she has learned what she still needs to remain on. We do test about once a year to make sure there haven't been any changes we need to be aware of. Any way we can make her body even healthier than it is. She's 13, so she goes to parties and she eats out. So occasionally she eats the foods that cause symptoms in her body. But she keeps it in check, she keeps it in balance. When it gets to be too much and those symptoms rear their ugly heads, she knows to cut back on those foods. But her family's been educated. They've been empowered. And that's what this is truly all about. And more importantly, Nicole is a healthy, happy, thriving 13-year-old. This is Dr. Steve Rosman of Rosman Whole Person Healthcare and your brain health doctor. My mission with children or adults is to help each and every one of you live an optimal life, a life in which you thrive, a life in which you succeed, a life which enables you to be joyful and happy. And that's what I wish you tonight, joy and happiness, and an optimal life. Good night.